Hi everyone, very good evening. I hope I'm audible and visible to all of you. I know it's rather late for a live session, but I also believe it's never too late with medicos studying for an exam. And I'm sure NEET PG students are in full swing with their preparation. Also more so ever since the FMGE exam got conducted and you started getting reviews of how a few things changed. So that has created a lot of panic as well. So first I'll quickly brief you about, it's just going to be a quick 15-minute session, not planning anything extensive because I'm sure you all have your own set of things to study from. But, an overview about what exactly is the PYQ challenge that we are starting with. So this is what it is on your screen. You've got a good chunk of PYQs if I keep the rest of the QBank and custom modules aside. PYQs alone across all 19 subjects are a lot for you to cover. So why not we make it into a 50-day timetable, which not just covers your subject, which you're anyway doing from your notes, but you're also supplementing it with PYQs. And then at the end of it, if we supplement it with a short session with a subject expert faculty, it makes it all the more easier for you to solve your doubts. So now for all the subscribers who have access to the app or who wish to take so, you will get access to the PYQs under the PYQ tab. These are the total number, and I know you are aware of 19 subjects that we have. If I give you a further subject-wise distribution of these questions, this is how it's placed over all 19 subjects. So you do understand that when I look at it as a cumulative number, it's a little overwhelming, right? But if I split it over the next 50 days, not only do I get a structured roadmap for my preparation, but I also cover it in a step-by-step fashion without feeling too overwhelmed by the number that we have in front of us. Also, if there are any questions, I will be taking them up, but exactly in 5 minutes once I give you a brief about this. Now, having said that, this subject-wise PYQ distribution, we have planned it along with faculty discussions. So let me just scan through this entire timetable, which starts exactly tomorrow. So now when I look at this, you can see it's going to start from 1st of July going all the way till 21st of August. So these 50 days will cover all 19 subjects, which is going to be a mutual effort. Like you will have to study the PYQs and then we will clear your doubts and we will give you our pointers, which we feel will help you in your preparation and in the last moment revision. So let's assume tomorrow and day after, 2 days you will be doing your anatomy PYQs under the PYQ tab of ANAT, and thereafter on 2nd of July at 7 o'clock, Azam sir will meet you and he will tell you about what are the things that you need to focus on. It's not that we'll be discussing the same PYQs again, which doesn't make sense because you've done them, then it becomes repetition. But then we want you to focus on some areas or some topics or some high yield pointers or errors which you tend to commit, and each faculty is going to make the session not very lengthy, not over 1.5 to 2 hours. That's the upper limit that we are targeting, but in that we are going to make sure that we catch those pain points which you have been making errors in and you can rectify them, or you can share your set of doubts and we settle them for us. So while the MCQs that you will be solving will become your self-study days and also the ones that you do on your app on your own, but these sessions which will be with faculties, these will be on YouTube. So this will be open for everyone to view, and this is something you can either take a screenshot, but it's already available on the app if you are a subscriber, and it is also available on all social media channels. We've given the number of days depending on the the subject that you're referring to. So we've got 3 days for pharmacology, we've got 3 days for PSM, we've got 3 days for micro, because these are the more demanding subjects where even solving PYQs takes time, and alongside you're of course doing your notes as well, right? So you can't do everything in a single day, which doesn't sound well. Same way, we have 1 to 2 days for all short subjects. Then we have path, thereafter we have 2 days for ENT, 2 days for ophthal, we have 2 days even for derma, which I don't think you need too many of these, but then you will have backlogs, so you want some days to cover up on those as well. It doesn't end here. After this we go to this next part of it, we continue with psychiatry, anesthesia, and after every set of PYQ self-study days are done, you can see that you have a session roughly in the evening on most days where the faculty or the subject expert will help you with whatever we have planned for your live session. And this goes all the way, ending it up no way better than to end it with all your clinical subjects, which have been the mega 4 have been kept in the end, because it's like now putting everything under one roof. And once you're done with that, we've also planned something special for you, which is a grand finale session on 21st of August when we will wrap it all up. So this is the 50-day plan that we have, and as I've mentioned for students putting up now, and of course you can ask your doubts as well, these 50 days, the PYQs will only be accessible to the students who you have subscribed to the channel or subscribed to the app for that matter, but the session that we are having by the faculties, those are going to be on YouTube and they will be free for everyone to access. LRR, the question that I'm getting, that'll be something which always happens in the last 10 to 15 days. So that's going to be a separate thing planned then. But we can't keep waiting for the last 10 to 15 days for the LRR to happen. And I say this to every exam going student, LRR will be an excellent resource meant to be followed only in the last 15 days. It shall never be your mainstay for preparation. So keep it to the last 15 days, keep it when it's actually going to help us, and that should not be something that we'll be doing right now. Right now, you should be doing your notes from whichever place you're doing, be it rapid revision or if you're a lab 2 subscriber, then you continue doing those notes. Changing of your source will be a disaster right now. You're not supposed to do that. But what we are adding on is supplementing your preparation so that PYQs get a little more streamlined. We also understand, and you know it, PYQs are not coming copy pasted. You saw the recent FMGE exam trend also. You've seen previous NEET PG questions. They are not coming as it is copy pasted, except for 5 or 10 which are usual ones which come every time, like the crumpled tissue paper appearance or the owl eye appearance. Now, those are obvious questions. But other than that, we're not getting too many copy pasted questions. So the faculty session over here is to actually guide you on how you've solved all the PYQs on the app, but now how should you be utilizing that further to up your preparation. That's what the faculty session is going to be all about, with doubt solving and of course teaching you important concepts closer to the exam which are meant for you. The PYQ section is in the PYQ tab in the app. So that's where you will be able to find it, and it is going to be subject wise. For everyone who is joining in now, the PYQ section of the app is where you will get the questions, and the YouTube session live is where you will get the live class by the faculties, and this is the timetable. At least to begin with, this is where we are starting. The self-study day starts tomorrow itself. So 2 days you will be doing anatomy PYQs. That's what sir is expecting, that you should be done and dusted with those when you join class, and that is when sir will be taking class at 7 o'clock on 2nd of July, and the rest of the schedule just goes exactly how it's planned. Do not ask me questions about NEET PG postponement, and honestly no one knows about it. These are all rumors, and the more time you spend on this, you are wasting very important time right now which you can use in preparation phase. No one actually knows about it. I was telling a few students who asked me this question almost an hour ago, because I think everyone's asking the same. We've had NEET PG postponed one night before the exam also. So if it can get postponed so close to the exam, then anything is possible, right? And if you're living in so much of uncertainty, then why break your head over it? Because then anything can happen. So it's better that I do not focus on all of that, and I focus on what is under my control, which is my revision schedule and strategy. Okay, FMG exam se kya takeaway message aaya? So number one question which people think they have understood now, but I think we've been shouting out since a while, that PYQs will never come copy pasted. So you can't just do that. I've done my PYQs, and precisely because we wanted to reinforce that point is why we came up with this challenge, that PYQs people are doing and thinking that as it is, maine sare 7,000-8,000 PYQs kar liya, now I'll score the best marks. It's not going to work that way. How do you twist and turn a PYQ and turn it into a new question is exactly why we supplemented it with faculty sessions, because I think that is where guidance was required from our end. So number one takeaway message is PYQ alone will never help you solve this paper or get a good rank in NEET PG. You will have to do notes plus PYQ plus custom module. That's the complete package. You should be prepared for new questions. You should be prepared for options where it's going to twist. Language will be twisted. The second takeaway message was, of course, your video questions which were added, which many of you are, putting it up. So video questions, if you go through some of the lectures, like ophthalmology lectures already have videos in it. If you've gone through the recorded sessions or the resolve classes, then the version X videos do have a couple of animations which were already added a year ago. But now that this pattern has become or created a source of panic also for a lot of students after FMG, so we are now trying to incorporate some GIF based videos, and within a week it should be available on the app as well. I mean, I'm telling you too much too soon, but that is only to ease your panic that we will come out with some way of helping you regarding those as well. Having said that, does this change your course of preparation? And the answer is no, because you should not be giving up on any of your timetable, your notes. This is going to be just a part of the exam, if at all it is implemented, and it is not going to just take over the entire exam. Also, the videos that were put up are not something from new signs and symptoms all of a sudden. They are actually what you were reading in theory up till now, or seeing images of, or imagining, that has been put to life, and now they're putting it up as 10-second videos or GIFs. So now the point is that you just need to be a little more aware, and you guys will be the most prepared, because in NEET MDS it was there in FMG, but it came as a shocker for the students. Now you're mentally prepared for it. So when written part will, it's something like either you get an image based question or you get it written in the form of text. So either they write Langhans giant cell, or they say there is horseshoe shaped arrangement of nuclei. That doesn't change much, right? You either which way can identify it's Langhans giant cell and they're talking about TB. Same thing they're going to do with videos as well. So give us a week's time. We are trying to incorporate this to the best of our ability in this shortest time possible, and within a week you'll get an update on that. Is this year-wise? Mostly year-wise, yes. The PYQs, is that what you're asking, Dr. Parmar? It's year-wise. Subject-wise, TND in the app, yes. In the app, there is something called RRR. That's just another fancy name for a test and explanation of your subject-wise. So that's already available on the app. That's gone. That goes by the name of Rapid Revision Reignite, or RRR. It means the same. Yes, there were exactly what I'm saying. You had lengthy questions, that was there. You had video questions. For FMG, what became all the more problematic was that none of this was expected. So obviously when you go in an exam, you already have that timer ticking in your mind that I have to solve everything in under a minute. Then you have exam stress, then you have environmental factors which are not suitable for giving an exam. So amidst all of this, then suddenly you get to know that the pattern of my exam has changed. It just adds so much of panic that what you're supposed to get right, you end up getting that also wrong. And that is exactly what happened with this FMG exam. I'm not denying the fact that that's a separate story, that the level of the questions was also tougher. The options, maybe the questions were not from a very random topic. Topics were pretty heard of, pretty known, but when they came to options, they started getting very close. Now, what is the takeaway message that we get for NEET PG students? Because we also need to understand we have very limited days left for your exam. There is no way that you can change your notes or your entire source or your Q bank. You've done all that effort. You've got your notes in place. You've got your bookmarked questions in place. So now you're not changing any source. You're just reframing a little bit of your way of solving questions. Just up the number of questions that you're doing, and hence we've come up with this, that we can help you if if there's a Q bank, and if we can do 50% of the Q bank in the form of a PYQ challenge, that is also a great push for a student to get into the momentum and not lose hope, especially so close to the exam with so many things happening around them. So rather than crying over what happened with the FMG students, now what the NEET PG students can do is take some advice, take some take home last minute pointers from that exam and try their best to implement it for the upcoming exam. So number of questions, if you were doing whichever X number, let's assume you were doing 100 every day, you should be doing 120, 130. Keep upping the number every day on a maybe 10-20 increments also will work and will go a long way. So now the number of questions increase, which tells you that where are you making mistakes, how are you responding in situations where you don't know the question, you've not seen that question before. Don't think you will get all familiar questions. There will be some which you've never heard of. How do you react in that situation? Sometimes you get stuck between very close two options and then you have to figure out the single best answer. So this only comes with practice. No number of video lectures or notes can help you solve how to get the single best answer. That only you and your own practice with the Q bank can do. So that is something which requires self-study and effort at your end, which is what you'll have to do. Right? For FMG students, if you're thinking about your results, don't. I think you've taken your own set of tension for now. So it's not very easy, but try to detach yourself from the exam. Try to just get over it, whatever little time you have. Try to just catch up on sleep, spend time with your family, with your friends, go for a vacation if it permits, or just do nothing. Just watch the most brain rot social media content. But I think you need time off from exam and stress because you've taken that for a couple of months, and it's very important to detoxify your mind that ways. For first reading, someone asking me, Dr. Dipali, LRR is never for first reading. LRR is not even for second or third reading. LRR is only for last 15 days for any exam that you're asking me. So first reading ke liye, if you have like if you're asking for next year exams for Path Micro, I will always say rapid revision for the first reading for Path Micro, because anyway rapid revision is very extensive. But if you have exams after 2-3 years, तो फिर तो you should do main videos and there is no replacement to that as well. But अगर 6 months में 8 months में exam है, then it's always rapid revision. 15 days में exam है, that is when LRR comes into play, not before that. Please don't think that my exam is after, let's say December if you're appearing for, and now you suddenly want to do only LRR for the next 6 months. That is not doing justice to the syllabus. For NEET PG students, last 2 months, what I would have done in your place with so many things happening around, final takeaway message is number one, I will look at these PYQs. This is something which is baseline se start karte hain na, that bare minimum, what is it that I have to do, and then everything else becomes luxury if time permits. So this is bare minimum, ye to karna hi hai. This schedule, whether you follow it live or you follow it on a 2x speed later on, this schedule will at least make sure that you have done the 7,000-8,000 MCQs or PYQs that were required. तो एक तो ये हो गया. साथ के साथ you saw advice from faculty which I think will help you keep giving you that push. If you want to follow this timetable, maybe this also works as a timetable. This is something which I would have done bare minimum के PYQ challenge मैंने अभी रखा for these 50 days, and for the last 10 days obviously a lot of LRR is going to come. तो LRR videos, those I keep for the last 10-15 days when they're actually made to help me. In between, what am I going to do? I am on a daily basis going to do my notes and my custom module. अब वो आप कौन से subject या strategy में follow करते हो? Either you follow this same, which means that let's assume you've been given 3 days for microbiology over here. 3 days are a lot at this given point of time. You're not reading it for the first time, right? You've read it before. 15 hours of rapid revision है, आपने assuming एक बार तो minimum पढ़ा ही है पहले. So you can easily do this in 3 days. You can finish off your notes, you can finish off your custom module, you can also do the PYQs that are there and attend the session. That will be one complete revision cycle, and in the end when the LRR comes, that becomes a second revision cycle for you. So I think I would have done this if given an option, or if you're already on track and things are going well with respect to your timetable, don't switch. Then this just acts as an add-on, plus one. Ke haan, when and if and when I will get time, when I'll do anatomy, I will pick up the video and I'll watch it. When I'll be doing patho in my own timetable, I will pick up the video and watch it. So then I just consider this as an add-on. I don't change my strategy. So if it's working well for you, stick to it. Do not change anything. If you're a little doubtful, lost, off track, not getting into the momentum of studies, then this is exactly what you're supposed to do. PYQ challenge के साथ साथ अपना एक subject you start finishing off. You don't want to stretch it to 50 days. You still have an option of finishing it in 40 days, because for a lot of subjects like psyche, derma, ortho, we have given 2 days because we want you to finish off your backlogs also. So maybe you can utilize and finish off this schedule earlier in 40 days. PYQs are always there on the app. You can do this in 40 days and use those extra 10 days for doing another set of revision. This is the smart planning that I would do if I would be in your place, but yes, to each his own, you will have to figure it out. Okay. Thank you, Dr. Sakshi, but I believe other than Dr. Sakshi, I cannot read anyone's message. But thank you so much, and I'm glad that you could attempt the questions. The revision cycle and LRR will be available on YouTube. Yes, the live session will be available on YouTube, and the LRR will be available on YouTube. How to integrate? That's what I'm saying. Dr. Day, if you have been doing the previous schedule and if you've been following it, because the problem with timetables is that we make and then we somewhere get lost in between. But if you've been the headstrong person and you are following it, then please continue following it. Do not change your timetable for this new one. What did I say? This then becomes as an add-on. As and when you will get time, you will follow this, and you will see if you're following the previous timetable, you've done your PYQs, na? And this means you only need to add on the faculty session, which you can do at any given point of time. This shall always remain for you to view later on also, which basically tells me that you are doing well and you need to stick to what you're doing. But if you are off track, lost somewhere in between, don't know what to and how to give a structure to your preparation, this is exactly what you get on to with. Okay. How to do PYQs? Simple, just pick up and do PYQs. Either you can, as I said, let's assume you are doing 3 days of micro, and let's assume you are going topic wise, right? So 3 days of micro, I am also assuming that you are on an average doing 5 hours of content every day, so 15 hours ho jayega 3 din mein. Then you can do half a day of notes, revision of the notes, and half a day of PYQ and custom module. So within 3 days, you will be done with all of it. That is how you should be doing. Right now, going entirely topic wise is not also advisable, right? Because in the exam, you get a mixed bag of questions. You need to be used to doing custom modules as well. So just keep division of 50% and 50% of the day. Half a day you are doing MCQs, half a day you are doing notes. That settles it for you. Other platform students, in case you are not subscribing and you don't have the PYQs, but you have some access to PYQs, I'm sure. It's not that this is the only app where PYQs are readily available everywhere, right? So then you continue with PYQs and this is what you watch. Even then you can benefit from this. For anyone who's following any other plan, if you are a Lab 2 subscriber, if you are an RRR subscriber, that is okay. None of these sessions are going away anywhere. You need to understand that every time something comes up, it's not that we have to panic and go into FOMO. We can work it around. हर बार ज़रूरी नहीं होता कि हम हर नए timetable के साथ we change our timetable. No one's telling you to do that. Sometimes we can consider things as a bonus and as an add-on also, ना? वो भी तो एक way of thinking है. That is also a perspective that we can give to this entire timetable, that it doesn't have to replace my existing strategy. It can be an add-on, something that will keep me on track and keep me accountable. That is another way to look at it, guys. For everyone, GT score या फिर कोई भी other MCQ related query that you have, you will solve it by doing more MCQs. There is no other way of breaking that plateau over here. First, analyze in your GT. Analyze, are you making subject wise errors? Because sometimes you have those 3-4 really poor subjects which every time get your score down. Or are you making generic errors कि हर subject में 2-3 question गलत हो रहे हैं मैम, so overall my score is coming down. If you have subject wise problems, you focus and revise those subjects in the next 1 week and finish off this problem. If it is a general thing where every subject is kind of mediocre, I'm getting it, I'm not getting it, then this means you need to solve more MCQs. Whatever X number of MCQs you are doing, you need to up it by 20%. You need to make those increments. More number of questions you will solve, more you will catch where you make mistakes. Sometimes I might make a very different mistake, a very different random silly mistake, and you might make something else because our brains work completely different, right? So I can highlight 10 top mistakes that every student makes, but ho sakta hai you are not making those mistakes. Your journey is totally different. You are on a different track and making new set of 10 mistakes which only you know. So how will you catch those mistakes when you solve more questions? Questions are not for your assessment. Questions are for practice. That is the approach you need to. You are calculating marks. कि मैंने 10 questions करे, how many marks did I get out of it? Till the time you have this approach, you will be very scared of GTs. Have the approach that okay, if I've done 100 questions, irrespective of what I got right or wrong, जो right है उनका explanation मत पढ़ो, जो wrong है figure out what is the explanation that I need to know in 2 or 3 lines, summarize it and move forward. Okay, I learned 30 new questions out of it. I won't make this mistake in the exam. So now the game of 60 days is about perspective, guys. It is not going to be about kitna zyada padha and how did I change my timetable every day. It is going to be every time I got a setback, how did I analyze it, and with so many resources around me, how did I keep one ground on one main strategy and timetable which I was following, and everything else that was coming across that just became as an add-on. And prioritize कि अच्छा, now we have so many platforms, so many, everyone will have a last minute revision session. Ideally, you should be watching the revision session of the faculty you studied from. You cannot watch the pathology revision session of 5 faculties because you have 19 subjects to do. Same, you cannot watch anatomy from 4 different YouTube channels. Time does not permit that. So you will have to prioritize कि किससे पढ़ा है. The best is whichever platform or whichever teacher you studied from, you do the last minute revision of that teacher, and that prioritization you will have to do, right? um, NEET PG specific LRR, yeah, Dr. Sumit, the LRR that I'm talking about will be a NEET PG specific LRR because the FMGE exam to khatam, INI bhi khatam, so yours is the only exam left. So we don't have an option but to have a NEET PG specific LRR. 2027 के लिए we are planning a strategy session, and I think within this week you will get a notification, so we will talk about that separately. Anything else? Clinical questions. You can use the clinical tag, anonymous doctor. You can use the clinical tag, and that will be the best way of solving those questions. Okay, so the videos will be available. They will go live. They are not recorded videos, so they will be conducted live, and then thereafter will be there, of course, for you to view even later on. If you miss it live, you can view it later on at 2x. Yeah, RRR for NEET PG, the TNE or RRR, that is going to be conducted. It is going to be conducted. I'll tell the team to share it on social media. जो final timetable, the schedule is, I'll tell them to share this. Okay. Thank you so much for joining in. This is starting from your self-study. This is starting tomorrow, and the faculty sessions are starting from 2nd of July. This is what the final is. If this is readable, you can take a screenshot, else just go on any social media platform. It is all available. It's there on the app as well, where they've put it up. The link is there, also pinned in the live chat. I can see it. It's also put up in the description, but I'm sure you have the PrepLadder app downloaded. If you open it, you'll see this popping up on the screen right away. So yes, I hope that I will be meeting you. If you have any other queries regarding this particular challenge that is happening, or any other class which you've not gone through the doubts which we've solved in the last few minutes, put it in the comments below and I'll get back to you. If it is to do with the technical part, then someone from the team will get back to you. Okay. Thank you so much for joining in. I wanted to keep it very brief so that it doesn't bother your existing timetable, doesn't waste too much of time, but I will be meeting you. And microbiology session is on 15th, path is on 20th. So I think by then you will already be in full swing. Many of your subjects will be done. Kept micro first this time because I wanted that this is somehow the number of questions of micro have exceeded more than path in the past NEET and in FMG. So I thought let's do the tougher thing first and let's keep them tension free. So yeah, that is what I've decided. Okay, thank you so much, and I'll meet you very soon. Study well, guys. All the very best.